She'll talk to us about intravitreal triamcinolone versus Ozurdex in retinal vein occlusion in treatment-naive patients.
Good morning, everybody.
Here.
Retinal vein occlusion. Retinal vein occlusion is the second most common retinal vascular disease after diabetic retinopathy. And the greatest sources of the visual loss are macular edema, macular ischemia, and the sequelae of neovascularization. We compared the efficacy and side effects of intravitreal triamcinolone with intravitreal dexamethasone implant, that is Ozurdex, in patients of macular edema secondary to retinal vein occlusion. Preoperatively, best corrected visual acuity was noted, intraocular pressure was noted, and central macular thickness was measured by OCT. And then the patients, after evaluation, received either intravitreal triamcinolone or Ozurdex. Patients with glaucoma or iris neovascularization, hazy media, or active ocular infections were excluded. On comparing the logMAR best corrected visual acuity, we noted a statistically significant difference between the preoperative vision and the postoperative vision, but there was no statistically difference when we compared between the two groups. Comparing the central macular thickness between the Ozurdex and IVTA group, there was statistically significant decrease in the central macular thickness in the two groups, but on comparing between the two groups, there was no statistically significant difference. This is the OCT image showing the preoperative macular edema and at the 6 months in the Ozurdex group. On comparing the intraocular pressure between the Ozurdex and IVTA group, there was a statistically significant increase in the IOP in both the groups, but it was statistically higher in the IVTA group as compared to the Ozurdex group. But it was well controlled with anti-glaucoma medications. So both IVTA and Ozurdex are effective in improving the mean visual acuity in cases of retinal vein occlusion. And there is a 75% efficacy in the Ozurdex group, and we found a 60% efficacy in the IVTA group. The rise in intraocular pressure was seen in both the groups, but was higher in the IVTA group, and hence required a higher number of intervention in terms of anti-glaucoma medications. None of the patients underwent any surgery. Cataract formation was seen in only one patient in the IVTA group and none in the Ozurdex group. That could be due to the smaller sample size and a shorter follow-up period. So on concluding this, the intravitreal steroids are an effective treatment modality in improving visual acuity and reducing macular edema in cases of retinal vein occlusion. The only concern was the rise in intraocular pressure, which was well managed with anti-glaucoma medications. Thank you.
Subsequently, have you tried at your institution about suprachoroidal injection of triamcinolone?
No, sir. So we can't give suprachoroidal.
What was the longest follow-up period in this study?
12 months.
12 months. So, and how many of the patients needed a repeat IVTA or Ozurdex?
In the Ozurdex group, there were 3 patients who needed repeat injections, and one patient received every 5 monthly. He received an injection of Ozurdex.
But triamcinolone did not need to be.
Also, patients received repeat injections, and they needed it at around 3 months follow-up.
And was there any significant difference between the repeat procedures between the two groups?
Ma'am, there was no significant difference. Ma'am, only the duration was there, ma'am, around 3 months के बाद उसमें लगाना पड़ा था, and after around 5 months Ozurdex was repeated.
Okay, thank you.